I'm Keri Thomas, the Clinical Champion for End-of-Life Care for the Royal College of GPs, and together we've developed this patient charter with the RCN and the Patient Partnership Group of the RCGP, and we've sent it to every GP practice through RCGP News and with some guidance and support on how to implement it in your practice. And we've developed a new microsite to be able to support GPs so that they can point to various training and resources and tools to help people improve care for their patients nearing the end of life. I run the Gold Standards Framework Training Programme, and many of you will know from accessing your QOF points that this is well evidenced and well respected guidance on identifying patients early, including them on your register, and then having some kind of plan for care. So we're trying to support GPs very much to implement this patient charter. We give guidance on how it could be used, take it, discuss it, give it to patients in your patient group, look at ways that you can implement it, and we really hope that more of you will sign up to this and use it as a means to improve end-of-life care in your practices. Thank you.
Hello, my name's Anthony Tutor. I'm Chair of the Patient Partnership Group at the Royal College of General Practitioners, and we were very pleased to work together with the Royal College of Nursing and with the Clinical Champion for End-of-Life Care at the Royal College of General Practitioners, Keri Thomas, on this patient charter for end-of-life care. The thing about the patient charter for end-of-life care is it's just really easy, simple steps on how practices can make life just that little bit easier and a little bit smoother for people nearing the end of their life, and also to support their carers.
Okay. Hello, my name's David Haslam. I'm a former president and chairman of the Royal College of GPs, and I'm currently president of the BMA. And a few weeks ago, one of my very closest friends had a pretty rotten death. Death is one of the things that is absolutely inevitable to every one of us, and there's few things that matter more in life than a good death. It's really, really vitally important that general practitioners and their teams get really involved with high quality end-of-life care. After all, one day it's going to be me and you.
Hello, I'm Iona Heath. I'm president of the college, and I'm here because we need to do more thinking about what we mean by a good death, the sort of death that we want for ourselves and those we love. And all of us as GPs have witnessed deaths that were good, where the patient felt in control and there was a sense of peace and dignity. But all of us have also witnessed deaths that were much less calm, much less dignified, marked by panic and fear and sometimes even anger. So we're really working hard at the college. We've adopted this as a priority to try and work really hard to think more about what we mean by a good death and how we can make it more and more possible for our patients and indeed ourselves to die of a good death in due course.
I'm Nigel Sparrow. I chair the Professional Development Board at the Royal College of General Practitioners, and I'm also on the Standing Commission for Carers. Care is a really important part of the work that we do in the college. 10% of our population are carers, and many of those are caring for people towards the end of their lives. We've done a lot of work with the Princess Royal Trust for Carers and now working with Carers UK to develop carer champions across all parts of the UK to act as a resource to help liaise with practices and carer centres to help people in this very difficult task. Even good practices only are able to identify about 3 or 4% of their list size as carers. So there's a great deal of hidden carers in the population who we don't know about, but are doing a fantastic job, and we need to recognise them as partners in care. They have a great deal of knowledge and a great deal of expertise, and we need to value that in looking after our patients. We have several resources within the college website in the carers section, and there will be links from this to the end-of-life part of the website as well to help practices support the needs of carers.
As a GP, I'm often distressed when one of my patients has gone in for end-of-life care into a hospital at the last minute. And often I think about this and I think, why has this happened? And sometimes, and quite a lot of the time, it's because I haven't thought about it and haven't done enough preparation with the patient and their carers. I'm particularly focused on people with learning disabilities because I know that often people will not talk about death with them or advanced care planning with them because they find it difficult to bring up, as we do with any patient, but particularly vulnerable adults. I think if we can get advanced care planning more into our normal way of talking to people and introduce it early, then we can prepare people for death and their carers so that we have plans in place so that when crises happen at the weekends or out of hours, then everybody knows what will happen and how to deal with it. Not every crisis can be prevented by this way, but I think we can go a long way to make sure that people die in their own homes with people they love, rather than being the last minute in an accident and emergency centre in the middle of the night.